Bismillahir-Rahmanir-Rahim.
A contact center is a business division within an organization that manages customer interactions. Unlike a call center, which receives requests only by telephone, the contact center handles inbound and outbound customer communication over multiple channels such as telephone, web chat, email, messaging apps, social media, text, fax, and traditional mail. Contact centers use various types of advanced technology to help resolve customer issues quickly, to track customer engagements, and to capture interaction and performance data. Customer service can be a significant differentiator for any business, and a contact center is often the primary channel for most of the interactions customers have with the company. Through a contact center, there are several ways to ensure an excellent experience. For example, customers can take advantage of the self-service capabilities provided by contact center in order to quickly perform common tasks. Contact centers can ensure customers are connected to the most suitable agent to resolve their problem faster. In addition, since the contact center supports multiple types of communication, customers can interact through the channel of their choice. Since contact centers are a central point of customer communications, they can improve the business productivity when responding to numerous customer requests. Contact centers can provide corresponding organization the ability to scale staff in response to customer inquiries, and automatically route requests to the most appropriate resource with real-time updates, allowing agents to respond quickly and efficiently. Contact center brings together customer interactions from across all communication channels. The data gathered from these interactions provides valuable insights that can help inform important business decisions. This information can help with product design, quality issues, and identifying patterns and problem areas across the customer's journey of engagement with the company. The healthcare landscape is becoming increasingly competitive as hospitals continually look for innovative ways to engage with existing and potential customers. As the first point of contact for most patients' hospital experiences, the contact center is more important than ever. Organizations rely on this team to deliver exceptional customer service while supporting exemplary patient care. With the help of innovative technology solutions, hospital contact centers are able to streamline their operational efficiencies, enhance the patient experience, and reinforce a positive brand image. Contact centers, the vital communications hub of any hospital, support improved patient care by helping to coordinate efficient clinical communications. This, in turn, can ultimately boost patient satisfaction scores and increase revenues. In a continually evolving environment, it's important to assess whether contact center is using best practices and the most appropriate technology to maximize its potential. Incorporating or upgrading new technology into existing contact center will enable hospital to increase staff satisfaction, improve efficiencies, and trim costs. The hospital's contact center would act as a one-window facility for customers, employees and people seeking information. The broad spectrum of its role and task would be practice operations, clinical services, post-acute coordination, virtual care facilitations and administrative services. When the patient calls or emails for registration, customer support representatives, CSRs, will request required details for on-call registration and their past medical history so as to minimize their wait time on arrival. Each patient will be issued with a temporary medical record number, TMR. The patient will have to present the TMR upon arrival for printing of registration card. Scheduling patients is one of the most important tasks performed by CSRs. It can also have a huge impact on the success of hospital. CSRs will try to keep missed appointments to a minimum and ensure that patients are seen by the doctor as close to their scheduled appointment time as possible. With the ever-increasing demand of patient response for practices everywhere, reminders, follow-up, and follow-through are key components to running a successful practice. Forgotten or deliberately missed appointments would cause revenue loss and daily appointment scheduling conflicts. CSRs would send out customized text message reminders, SMS reminders, email reminders and telephonic calls to patients to ensure their timely arrival as per schedule and adjust the appointments accordingly in case of cancelled appointments. Clinical messaging helps to improve quality, which is the reason the healthcare exists in the first place. It can accurately capture all the mandated preventive care measures, demonstrating compliance with standards in a manner that can improve the star ratings. Clinical messaging is a standard measure of quality throughout the healthcare industry and is increasingly becoming tools that employers and individuals use in selecting healthcare providers. Referral coordination can also be termed as care coordinators, referral coordinators, or referral managers and the like. The description of area of responsibility seeks nurses and combined clinical with referral management functions. Some positions are strictly clerical, dealing exclusively with information transfer and insurance authorization. Better coordination between referring physicians and specialists increases physician satisfaction with specialty care and enhances referral completion. Improvements in the referral process may be achieved through better communication and collaboration between primary care physicians and specialists. A medical answering service is essential for on-call physicians. Patients need to know doctors can be reached 24 hours a day in the event of an emergency. A highly organized answering service not only makes the initial call to the doctor on call, but also places a follow-up call to the patient to ensure someone has responded. Giving any medical advice to callers is legally deemed as medical practice provided the nurse is functioning within the nursing scope of practice. A nursing assistant would be established to providing telephone triage, if required. A refill is the continuation of an existing prescription. Eligible refill prescriptions are shipped directly to customers after they place order at contact center. Renewal prescriptions are necessary once a prescription has no refills remaining or it has expired. For entitled patients, continuous treatment is same as refill service. It's the continuation of an existing prescription. Eligible refill prescriptions are shipped directly to customers after they place order at contact center. Renewal prescriptions are necessary once a prescription has no refills remaining or it has expired. As per policy, the continuous treatment is valid only for 3 months. In an age when electronic communication often helps simplify and speed access to information, PAF Hospital will be equipped with patient e-visits facility. E-visits do not require patients to go into a clinic to be seen in person by a care provider. Rather, patients can call contact center and answer several questions specific to their ailment. Within 2 hours, they will receive a response from their physician, including a plan of care and a prescription, if needed. Critical lab values are defined as values that are outside the normal range to a degree that may constitute an immediate health risk to the individual or require immediate action on the part of the ordering physician. It should be the policy of the clinical laboratory to intimate such tests to contact center so that notification call may immediately be made to the patient. Alternatively, the HMS should be intelligent enough to pop up alerts in case of critical test results. The dissemination of information regarding health outreach campaigns being planned by the hospital, to all key health workers, employees or the general public would also be managed by the contact center. Health outreach campaigns are dependent on various factors including prevailing ailment in the region, weather effects on general public, events, weeks organized world over or any special campaign planned by the hospital. Poor care coordination and post-discharge practices leave patients feeling confused and frustrated, decreasing the likelihood that they'll adhere to medication and discharge instructions and increasing the likelihood of an unplanned readmission. In this context, a precise post-discharge coordination model will be implemented and followed at contact center. Dispatch services is a setting in which selected types of healthcare can be delivered in the home to suitable, consenting patients who require inpatient hospital care. Keeping in view the increasing fiscal pressure on hospital and patients' choice, dispatch services are considered a viable alternative for provision of acute care at home. There could be cases where the patient needs rapid assessment and stabilization, which would not be possible at home. In such cases, a quick decision-making would be imperative based on rapid recognition of the acuity. Telemedicine is the practice of medicine using technology to deliver care at a distance, over a telecommunications infrastructure, between a patient at an originating site and a physician, or other practitioner licensed to practice medicine, at a distant site. Whereas telehealth refers to a broad collection of electronic and telecommunications technologies and services that support at a distance healthcare delivery and services. Telehealth technologies and tactics support virtual medical, health and education services. Contact Center will be managing and coordinating the telemedicine and telehealth campaigns. Healthcare organizations driving towards better patient engagement are providing patients with the ability to view, download and transmit their health information through online patient portals. Proper support is critical to the ongoing success and growth of the patient portal and patient engagement. Online support, may it be through social media or patients encountering problems in accessing patient's portal or retrieving required information, would be managed and guided by contact center representatives. All the floor manager and their patients' interactions would be managed by the contact center as care coordinators, referral coordinators or referral managers. Contact Center would be managing social media marketing campaigns and day-to-day activities including, develop relevant content topics to reach the hospital's target customers. Create, curate, and manage all published content, images, video and written, and monitor, listen and respond to users in a social way while cultivating leads and sales. Being the center point of contact for the public and employees, the contact center would have enormous feedback data pertaining to issues, problem areas, weaknesses, etc., based on the information, feedback gathered at the contact center pertaining to any field would be beneficial in assessing the weak areas of the hospital and hence suggestions would be shared with hospital management for improvements needed in weak areas. Attendance systems being installed at the hospital are not being managed efficiently. Contact Center will be responsible to ensure effective utilization of these systems by printing and sharing daily attendance report with HR department. Logging of all complaints pertaining to the building works issues, their pursuance with relevant experts, till their completion would be managed by Contact Center. Currently a separate section has been established for said purpose, which would not be needed after operationalization of Contact Center. A separate desk would be managing all the telephone-related complaints, inquiries and bookings. Establishing a contact center is a cumbrous process and requires assistance from various departments and directorates. Details of establishment arrangements are flashed. It is imperative to highlight that hospital would not have any cost effect except hiring of manpower. The communication infrastructure and required communication equipment is already available with Communication Center as it was well perceived during the network planning phase before the construction of hospital. Director Admin and Security has very kindly provided the required furniture. The option for getting the add-ons developed from Civil Market or through IT Directorate is still open and requires management decision. The detailed requirements have already been communicated officially to respective directorate for development. Now the house is open for questions and answer session.